our Senator Paul Sarlo, our Assemblyman Clinton Calabrese. We also have our Director of the Passaic County, thanks to the governor and now commissioners, our Director Pat Lepore. We have Commissioners Caridi, along with Commissioner Edelman. Yes, thank you. If I have missed anyone, my apologies. I'm very excited about today, especially about the announcement that the governor will make, expanding healthcare opportunities for the children in the state of New Jersey. The city of Passaic, a city of over 70,000 residents, where 70% of the population are Latino, are often brought together in terms of our numbers and demographics in those groupings of underserved communities. You know, when I considered the words that were being used to describe this amazing initiative, the Murphy expansion of healthcare, expanding healthcare opportunities, which I believe does a good job describing what this policy, what this new direction will do. But I don't think that it truly describes the impact in our community. Today we stand here at 220 Passaic Street, a fitting place, as we are at North Hudson Community Action Corporation. We have with us the Executive Director, Joan Quigley, an amazing partner to our city in serving that underserved population. Every single day, mothers and families come here to receive much needed health care. I considered what it truly means in a city where over 30% of the population has been identified as being under the poverty line. It's over 20,000 people that could potentially each day go to bed hungry, each day deal with food insecurities. I had really pondered what it means to expand healthcare to this population and throughout our state of New Jersey, and this is what it truly means. In a year of pandemic, where we hear the word relief often mentioned, relief and stimulus package, I thought of that. The relief for parents, relief for mothers, relief for families considering that they no longer have to worry whether or not some kind of health crisis or a situation would result in their child not receiving the much needed resources available to them. No one in this city or in this state or in this country should be scared that their child won't receive health care. I had considered that when Governor Phil Murphy had run for office, he had mentioned that he would stand strong and fight for those who are most vulnerable in our community, that he would not forget about what are often referred to as the little people, those who are marginalized and don't have a voice, that he would use his platform to amplify their voices. I have considered over these years where First Lady Tammy Murphy, who walked these streets during our parades, who has visited often, spoke to mothers and children, and took up the cause of defending the rights and health care rights of mothers, especially those who are often ignored, who don't have access to health care, who don't have follow-up. You know, my wife, as a public health nurse, shared with me that at specific conferences, First Lady Tammy Murphy had stated many of the difficulties and challenges of women of color, of women who don't have the ability to speak necessarily as many of us do in the English language, and how their rights are often forgotten and they don't receive the health care that they need. I want to thank our Governor Phil Murphy. I want to thank the First Family. I want to thank all of the elected officials that are here, because the impact that will be made in our city will be beyond what any words can describe. Y le quiero dar la gracia específicamente a nuestro gobernador, Phil Murphy, a todos los legisladores y los representantes aquí, que con esta iniciativa y esta medida, ellos van a poder cambiar la ineptitud que existe ahora mismo para la comunidad latina y muchos individuos, personas de colores, que no tienen acceso a atención médica o a seguro de salud. Esta medida que está tomando nuestro gran gobernador va a proteger a todos los niños del estado, no importa si tienen documentación, no importa su estatus, porque él dio un compromiso, él dio su palabra, que cuando él iba a ser elegido, él iba a defender a todos. Y de la profundidad de mi corazón, abajo de esta administración, yo quiero decir que yo le agradezco y le doy la bienvenida a él y a todos. At this moment, I would like to call up Ms. Rosa Paraga, who will speak specifically as to this initiative and the governor's initiative and direction. Rosa.
Buenos días a todos.
Good morning, everybody.
Mi nombre es Rosa Párraga. Es un honor estar aquí hoy. Me siento afortunada de vivir en un lugar como New Jersey, donde he tenido oportunidades que nunca hubiera imaginado.
My name is Rosa Párraga. My name is Rosa Párraga. It's an honor to be here this morning. I am proud to call New Jersey a place where I can live, a place where I can live opportunities never imagined.
Yo nací en Perú, pero fue aquí en New Jersey donde pude realizar todos mis sueños y hoy soy dueña de un restaurante en Patterson.
I was born in Peru, but it was here in New Jersey where I was able to live my dreams to open a restaurant here in Patterson.
Pero algo que mi negocio no me puede ofrecer, a mí y a mi hija Andrea de 7 años, es un seguro médico.
But something my business is unable to offer myself and my daughter, Andrea, of 7 years old, is health insurance.
Siempre ha sido difícil ir al médico sin preocuparme de la factura.
It's always been stressful to go to the doctor and not know how I will be able to pay my bills.
Y con la pandemia ha aumentado mi miedo.
And the pandemic only heightened my fears.
Una campaña como Cover All Kids, seguro para todos los niños, me da una sensación de alivio y seguridad al saber que mi menor hija podrá tener atención médica y ser una niña saludable y vibrante.
A campaign such as Cover Our Kids, Cobertura para todos los niños, gives me a sense of relief to know that my daughter will be able to get the medical attention that she deserves.
Gracias al gobernador Murphy y a todos los que están trabajando para hacer posible este programa.
Thank you to Governor Phil Murphy and everybody who has worked to make this program possible.
Ahora es un placer para presentar al gobernador Phil Murphy.
I'm good. Thank you. Thank you, Rosa. I'm going to take my mask off just for my remarks here, if that's all right. Buenos dias. Good morning, everyone. Thank you. Let's hear it one more time for Rosa Párraga. Rosa, bless you. Que Dios te bendiga. Thank you for sharing your story and providing the reason why we are, in fact, here today. Thank you, Mayor Hector Laura. Mayor, we love you. You are a man of the cloth. You're a great mayor. You're one of the great leaders in the state. God bless you, Mayor Hector Laura. It is a treat to be here with the team at North Hudson Community Action Corporation. A huge shout out. I'm not sure who put her in the back row. I would have put you in the front row, Joan. But a huge shout out for former state assemblywoman, outstanding journalist, and the president, Joan Quigley, and her team for opening the doors today, Joan. Thank you. I had the great honor to meet some of your colleagues, and you're doing fantastic work here. I also, down here to my left, I'm honored to be joined with two of our administration's great champions for healthy families, the Commissioner of Banking and Insurance, and former Assemblywoman, I might add, representing Passaic, Marlene Caride, Madam Commissioner. And to her right, the Acting Commissioner of the Department of Human Services, Sarah Edelman. Sarah, great to have you with us. I also want to acknowledge somebody on our team who heads the Office of Healthcare Accountability and Transparency, Shabnam Salih. Shabnam, bless you and thank you for everything you do. No matter how good a job we do in New Jersey, I don't know where we would be without the folks who are fighting tooth and nail for us every single day in Washington. And there is no better fighter in this state, I might argue in this country. Let's hear it for Congressman Bill Pascrell. And of course, it takes a village within New Jersey, and we cannot leave out the extraordinary legislative partners who have been invaluable in the work that we've undertaken together to give New Jersey stronger and fairer health care, the marketplace every resident deserves. Starting with the Senate Health and Senior Services Committee Chairman, Joe Vitale. Joe, honored to have you with us. To his left, Senate Budget Chair, Senator Mayor Paul Sarlo. Paul, again, great to be with you today. Passaic's own, the one and only Gary Scher. Gary, bless you. Visiting from Middlesex County, an outstanding leader, Assemblywoman Yvonne Lopez. Yvonne, always an honor. We have Assemblyman Clinton Calabrese. Clinton, honored to have you here. So the entire Team 36 is in the House. Hats off to each and every one of you. Pat Lepore was mentioned, but I want to reiterate how great it is to have him here. He's the Passaic County Commissioner Director and is doing an extraordinary job. Pat, to you and your colleagues, thank you for everything you do. And I must give one other shout out, and that is in addition to Joan's team, the outstanding members of law enforcement who are with us, who do an extraordinary job each and every day. Thank you, gentlemen. So when I presented my proposed state budget for the upcoming fiscal year, it included a simple yet I think profound principle that no child in New Jersey should be left without the support and security of health care coverage. Thankfully, there are millions of New Jersey children who are protected by their families' health insurance plans. Hundreds of thousands of others benefit from the coverage provided by the New Jersey Family Care, which I might add Senator Vitale helped create and has continued to champion. Thank you, Joe, for that. But even with these policies and programs in place, there are still roughly 90,000 children across our state without health care coverage. They cannot see a pediatrician or, God forbid, use an emergency room without their families wondering how the bill is going to be paid. And to be sure, the COVID pandemic has only exacerbated these fears for all families, as Rosa quite well laid out. We know, too, that these fears are especially palpable among our immigrant communities. Fortunately, we have places like right here, the North Hudson Community Action Corporation, that provide quality care to the uninsured in our state, but we know that lack of coverage remains a significant barrier to regular and quality care for so many more. And we know that health care can be made more affordable for all when we expand access to such frontline care which can help prevent trips to the emergency room, which are vastly more expensive. It is unconscionable that in New Jersey, a state with one of the strongest legacies of leadership in the healthcare arena, and especially in the year 2021, that this is the reality for thousands of families and kids. We must change this. And through our proposed Cover All Kids initiative, we will. And in doing so, we will become part of a vanguard of states to give more children the guaranteed security of health insurance coverage. The beautiful part is that we can do this. We can bring tens of thousands of kids under the protective umbrella of health care coverage for what would be a modest overall investment. Our budget envisions a more strategic use of our federal Medicaid funds. With a $20 million first-time investment, we can extend health care coverage to approximately 53,000 currently uninsured children in the next year. That's 53,000 out of a total of what we believe to be about 90,000 kids who are uninsured. And over the next 2 years, we can bring the rest along. And the cost of inaction will surely be much greater. But even with the modest investment, this will not be an easy task. We will need to work across state departments and with our legislative partners to remove existing barriers and refocus existing programs. And working with Congressman Pascrell and his colleagues, we will need to ensure partnership from the federal government. Thankfully, we have a new federal administration under President Joe Biden and Federal Health and Human Services Secretary Javier Becerra that is willing to be this essential partner. As I noted, the current pandemic has only heightened the anxiety of families over the future of their health coverage. We have worked hard to lessen those fears, and that work is evidenced by the fact that many of the healthcare policies purchased on our new statewide exchange, Marlene, are carrying monthly premiums lower than those of at any other point in the history of the Affordable Care Act, and that goes back to 2014. But every challenge also brings with it opportunities. And the challenge posed by the pandemic, which has given us this opportunity to ensure that every member of the next generation of New Jerseyans can have high-quality health care, and with it, a healthier childhood and indeed life. That is the true promise of the Cover All Kids program, and that is the promise of New Jersey. I once again thank each and every one of you for being here today and for all of your support. With that, it is my great honor and privilege to introduce our state's best fighter, among the best in the country. Please help me welcome Congressman Bill Pascrell. Love you, man. Thank you.
Good morning, everyone.
Good morning.
It's a great day in Passaic. It's a great day for New Jersey. And it's a great day to honor all the work that's been done leading to this point. Thank you, Governor. Thank you, Mayor, for bringing us all together here on this beautiful morning. I want to thank the Governor for highlighting this critical issue, and Mayor Laura for getting us here. Ensuring that every child across this country and in the state of New Jersey has health care coverage is paramount, very paramount, to a healthy future. It is why President Biden's American Rescue Plan gave states an additional financial incentive to expand Medicaid and strengthen coverage for current enrollees. It is a shame that not every state expanded Medicaid. And Governor, you mentioned Secretary Becerra. I had the fortune to work with him on the Ways and Means Committee. He's a true fighter. No one has been better prepared for that job. I mean, he's not a doctor, nurse, or one of those guys and gals, but he is very prepared to run the nation's health. I can assure you that. And I'm counting on him to deliver, not only for New Jersey, but for the entire nation. New Jersey expanded Medicaid in 2014, not too long ago. And as of August 2020, more than 1.8 million New Jersey residents were enrolled in either Medicaid or the CHIP program. To crush this virus, and we're not going to be better unless we crush the virus. We are not going to be economically or health-wise if we don't get ahead of the virus. And if we worked on that point from the very beginning, we'd be a lot better off now. The American Rescue Plan fills gaps in Medicaid's coverage. We have made testing, vaccines, and treatments available to all Medicaid enrollees and many uninsured people who, for over a year after the public health emergency ends. It is central to our fight. It is central to the recovery of this nation. Governor Murphy has been a stalwart leader from the very beginning. We meet once at least every week for an update on where we're standing and what we're doing. And to listen to our delegation is really martyrdom for you. To crush this virus, that rescue plan does fill the gap. We've made testing and the vaccines so important. Governor Murphy, let me thank you again. It's due. I know he has been under extraordinary stress to provide critical government services. Thanks to his leadership and additional federal resources we brought home, the state's Medicaid program launched the Cover All Kids initiative. New Jersey Family Care will utilize a $20 million appropriation from the state's budget proposal. Thank you to the senators and the assemblymen. You've done a great job on your own, to prepare us for this day. Thank you. The state's budget proposal will invest in the coverage for over 88,000 children across our state who lack coverage. Think about it. So what? We're not talking, we're doing. You know? You don't take as long as the Congress does to get its machine rolling, lubricated, ready to serve the people. Health coverage and access to health care have never been more critical. And as we look to crush COVID-19, safely reopen schools, and help families recover from this health and economic crisis, we must prioritize the solutions that will help our children and families stay healthy. You know, one might say how difficult it was to get the president's legislation passed, but my friends, I don't have to tell you really, there's nothing more important than the kids. We're very fortunate to have a governor who's sensitive to it, a mayor in our own town here that's sensitive to that issue, a legislature of senators and assembly people very sensitive to that issue. If we can't help our kids, we ought to pack up and go home. That's how I feel about it. So thank you to the commissioners who are here, and I want to point out, I got my start with Joan Quigley. We were in the state legislature together. We created some havoc down there. And as John Lewis would say, get out of our way. We're about to bring peace and love to the country, and we don't need any interference. And I mean it, folks. There's no turning back now on many issues, and today we're here for health and our kids. Thank you very much, and God bless you. Have a wonderful holiday. Thank you.
Thank you, Congressman. Let's hear one more time, Congressman Bill Pascrell. Joan and Bill, from what I understand from Gary and Yvonne, they're still making up for all the havoc you guys created way back then. I meant to thank my colleague Marilyn Rivera, who I've just lost, who helped translate Rosa. Thank you, Marilyn. With that, please help me welcome a guy. When you hear the words healthcare in New Jersey, and I'm talking now decades of leadership across the board, especially as we're here today to talk about healthcare for kids who are uncovered, but literally across the board. There is no better leader. There's no one who's been at the vanguard more so than this guy. Please help me welcome Chairman Senator Joe Vitale.
Good morning, everyone. Thank you, Governor. It has been a long time, and this is a terrific day, and I'm really here to celebrate the governor's initiative and work with the administration on this. You know, Governor mentioned decades of work, and we first introduced what was then Kid Care in the CHIP program back in the last century. We've made some great strides, but the one vexing problem that we've always faced as a legislature and as, I think, policymakers is making sure that every child has not just access to health insurance or access to health care, but good quality health care and good benefits. And the CHIP program, the Medicaid program in New Jersey is robust, is terrific, but we still have leaving behind nearly 90,000 children, and maybe even more. So the one vexing issue has always been, how do we get to those kids? And we've made some changes. We've required hospitals to enroll newborns, but it's not just there. It's everywhere, particularly in communities of color, where there's a language barrier, the culture barrier, where those who come to this country and come from a country where insurance is a foreign concept. They don't understand it. And when you come to the door and say, hey, we're the government, we're here to help, it's not so reassuring. And so there's plenty of work for us to do, and working with Commissioner Edelman and Commissioner Caridi, I know we'll get this done right. The governor in his budget proposal has appropriated enough money to do the outreach, to make sure we do it in a smart manner, that we actually reach these kids, reach these families, earn their trust, and get those kids enrolled. There's nothing more important than having a kid have access to care. All those families and parents who are here today understand what it means when your kids are sick. But imagine you're a family member, you're a mom, you're a dad, and you just can't afford to take them. Or you do, but you get a bill that's just not payable. And God forbid it's something more serious, and you just don't have the access like I do, like the governor does, like most of us here have access. It just doesn't work for them. So thank you, Governor, for the work you're doing. And I also want to mention First Lady Tammy Murphy. Her work on child and maternal health is really part of this initiative in a very special way. Reaching those families, reaching those kids, making sure those moms are healthy, that they're delivering their babies in a healthy manner, and those kids are taken care of after they're born. So, Governor, again, thank you. And for all the advocates here, Joan and everyone else, we miss you down there. We have a few troublemakers left over, but but you did it in a great way, Joe. So we do miss you down there. But for all the advocates and the workers who are in the field every day doing this work, taking care of our kids and families, thank you very much.
Well
Thanks,
said,
Governor.
Joe. Thanks for the good work, Joe. Let's hear it one more time, Senator Joe Vitale, and thank you for the very gracious words. It takes a village. It takes both chambers of the House, so we've got two outstanding representatives of the General Assembly. Please help me welcome another great leader out of Middlesex County, along with Senator Vitale. Please help me welcome Assemblywoman Yvonne Lopez. Love you. Bless you. Happy Easter.
Good morning, everyone. It's a pleasure to be here. I'm delighted to stand with Governor Murphy, my esteemed District May Senator Vitale, Commissioner Adelman, and Commissioner Karid, healthcare advocates, county and local dignitaries, in support of thousands of children across the state of New Jersey. It's hard to imagine a world where children in New Jersey are uninsured. However, as we stand here today, more than 90,000 kids are lacking access to health care. Every child needs to have a successful future. That's 90 kids without regular screenings, without access to specialists, without preventative care, and more importantly, 90,000 kids in the state of poor health as compared to their insured peers. Now more than ever, we know the importance of access to health care, and yet this startling statistic remains true. Although the state has made great strides to ensure coverage for children, I think we can all agree that one child without coverage is too many, and our benchmark for success must be covering all kids. The good news is that with the partnership of Governor Murphy, thank you, Governor, his administration, and the amazing coalition of advocates that are assembled here today, we have an opportunity to reach that exact benchmark for success. The legislation Senator Vitale and I introduced charts a course to address the issues barring our kids from receiving coverage. We will expand eligibility to all children who meet that income requirement, eliminate the burdensome 90-day waiting period, reestablish the New Jersey Care Buy-in Program, and ensure a robust outreach program that will target every child in need. This roadmap will get us closer to the goal of ensuring coverage for children and bring tremendous peace of mind to thousands of worried New Jersey parents. We know for certain that access to quality health care, especially for children, creates a foundation for future successes. Covering all children, covering all kids, will not only restore healthy equity to children, but will also create countless benefits for generations to come. As the state of many firsts, I am proud that New Jersey is working towards seizing this historic opportunity. Thank you. Thank you. Thank you.
Including in the win. Well done. Thanks, Yvonne. I mentioned we've got two outstanding members of the Assembly. This guy did not have to travel today. He is Council President. He's an extraordinary member of the Assembly. Please help me welcome your very own, the one and only, Gary Scher.
Good morning, Mr. Governor, Congressman, my mayor, my incredible mayor, Hector Lara, and so many other dignitaries who have joined with us today. Let me share with you some salient points in today's legislation drafted by my very good friends in the Assembly and in the Senate. $20 million health care coverage for 88,000 uninsured children in the state. $8.5 million to permit new mothers on Medicaid to retain health care coverage throughout the infant's first year of life. $6.85 million to allow 20,000 additional senior citizens to utilize the pharmaceutical assistance to the aged and disabled and senior gold programs. $25 million to reduce monthly premiums for those who purchase their own health insurance. Assemblywoman Lopez, Senator Vitale, Mr. Governor, This is the game changer that we have all been waiting for. This is the difference between not doing and doing. This legislation will make fundamental change, not over there or over there, but right here in this wonderful city of Passaic. And because of the leadership in the Senate, because of the leadership in the Assembly, and because the leadership of our governor, our commissioners, and so many others, this is the game changer. Last week, the Assembly passed a bill. The bill is now going to the Senate, not this bill, but another health care bill. And I made a commitment to myself, Mr. Governor, not to take away from this extraordinary bill today, but to mention one other bill that the Senate will soon be contemplating, and that we have worked in tandem and in partnership, Mr. Governor, with your office. A bill that will identify and over the next 10 years eliminate lead in water. There are 4,500 of the 88,000 uninsured children in New Jersey who will be identified this year and next year and in the past and perhaps only in the immediate future, who will be diagnosed with lead poisoning. We speak about taking a village, Mr. Governor. We speak about making the difference. I look forward to the lead bill making that difference. But I will tell you what you have all gathered here to witness today and to participate in is legislation which we could only dream about. Mr. Senator, Madam Assemblywoman, thank you for your leadership. Thank you for making the difference. And Mr. Governor, thank you for your stalwart work each and every day to make New Jersey a better place for all. Whatever your background, whatever your language, your culture, your religion, we make the difference with this legislation today. Thank you very much, Governor.
So well said. I love the lead bill, by the way. Well, I'll tell you, that is another great piece of legislation, because we all know lead poisoning is a scourge in our state and especially in our kids, and the impact, whether it's learning, disability, or other health impacts, stays with those kids for their life. So, Gary, thank you for leadership on this, on that, and so much else. Point of personal privilege, it's his district. He's another great leader. He and I were together yesterday celebrating the 100th anniversary of the New Jersey State Police. Please help me welcome for some closing remarks, Budget Chair, Senator, Mayor Paul Sarlo.
Thank you, Governor, Congressman, our great mayor here in the city of Passaic, to my colleagues in the legislature, to my good friend Marlene Caridi. I miss you, Marlene, so much. All the years we spent working together in the legislature. Yes, Governor, it was great to see you yesterday at a great event in Trenton. You've heard from my colleagues the profound impact that this appropriation will have on the state of New Jersey and those children who are uninsured. I will just say this. As the chairman of the Senate Budget Appropriations Committee for the past 12 years, when the governor makes modest strategic precision investments like this, it makes our job so much easy. How could you go wrong with a $20 million investment to take care of our children who don't have medical insurance? I'll leave it at that. This is a modest strategic investment to help those children in our great state and right here in the city of Passaic who are lacking health insurance. Great job, Governor. Great job, Chairman Vitale and my assemblymen, the assembly folks up here. Great job on a team effort to make this investment. God bless.
Thanks, man. That was short. Thank you, Paul. So that's it. Cover All Kids, a game changer in the state of New Jersey and communities just like Passaic. I want to thank, let's hear it again, Rosa Prago. Thank you, Rosa. God bless you. Mayor Hector Laura, one of the great mayors in the state, Congressman Bill Pascrell, Senator Joe Vitale, Senator Paul Sarlo, Assemblywoman Yvonne Lopez, Assemblyman Gary Scherer, Commissioner Marlene Caride, Acting Commissioner Sarah Edelman, Commissioner Director Pat Lepore, to everybody out there, and Joan Quigley, to you and your team for hosting us here at this extraordinary organization. Bless you all. Thank you all. If you're celebrating Passover, bless you. We wish you a great Passover. Please do so responsibly. If you're celebrating Easter this weekend, again, bless you. Please do so responsibly. God bless you all. Que Dios te bendiga. Thank you.